On this Saturday night, the growing probe into sexual misconduct in the military. Major General Dany Fortin under investigation.
I think now it's just crept a little bit closer to us in the civilian world.
He was the face of Canada's vaccine rollout. Who's in charge now? The disturbing instability in the Middle East.
But this is a flare-up that has been lit by a match.
When will the world intervene to put out this fire? The need for nurses in Canada and the students ready to do the job. Plus, the future is here, investing in electric vehicles.
Global National with Robin Gill.
Good evening and thank you for joining us. The man tasked with leading Canada's COVID-19 vaccine rollout has stepped down. Late yesterday, Major General Dany Fortin was suddenly removed from his role pending the results of a military police investigation. The government has released few details, but Global News has learned the investigation is looking into allegations of sexual misconduct. As Abigail Bimman explains, Fortin is just the latest high-profile military member to be accused.
To prepare for an unprecedented distribution of vaccines across the nation.
He's the face of the federal vaccine rollout. Major General Dany Fortin, known for leading Thursday briefings on the state of dose distribution and arrivals. Now he's forced to step aside while military police investigate an allegation of sexual misconduct that predates his time as a general.
My first reaction when I heard the news was, oh no, not again. To be honest with you, because like a lot of heads have fallen. That being said, despite that initial shock, I'm not really surprised.
Global News reached Fortin by email. He did not wish to comment. This is the latest of a string of high-ranking officials to face misconduct investigations, including former Chief of the Defence Staff Jonathan Vance and his successor Admiral Art MacDonald. Defence Minister Harjit Sajjan said in a statement he is committed to working to build a true culture of inclusion. And as for the handling of part of the government's biggest file, we remain focused on the vaccine rollout.
I think now it's just crept a little bit closer to us in the civilian world.
Lena Tamsito hopes this doesn't impact anyone's decision to get vaccinated, and she does think this latest investigation makes the string of military misconduct stories hit closer to home.
This individual who has been in sort of, I guess, our daily lives as Canadians, as civilian Canadians, is now being subject to something that has been impacting the military as a whole. So I think this might shift Canadians' perspective.
There has been no comment yet from the Prime Minister. His office pointed us to Sajjan's statement and to the 4.5 million doses that will arrive this coming week. We've also asked the Public Health Agency of Canada a number of questions about what comes next and who will take the lead, but they said they won't have an answer before Monday. Robin?
Abigail Bimman in Ottawa. Thanks, Abigail. Now to the crisis in the Middle East. Right around the world, thousands are hitting the streets. In Winnipeg, there was a pro-Palestinian rally at the Legislative Building. Then a group carrying Israeli flags arrived. The police had to form a line to keep the two sides apart. There were no confrontations, and it ended peacefully. But nowhere is the divide more exemplified than in the Middle East itself. The conflict is now into its 6th straight day, and neither side is interested in de-escalating the violence. As Crystal Gumansing reports, pressure is mounting on the international community to resolve the crisis.
It's not officially a war, but the images and the impacts are the same. 10 members of a Palestinian family who had gathered for Eid were killed following an Israeli airstrike. A baby, the lone survivor, found clutching his dead mother. Palestinians say at least 140 people, including 39 children, have been killed in Gaza since airstrikes began on Monday. Tammy Jacoby is a professor with expertise in Arab-Israeli conflict.
There's no middle ground, and so people are being radicalized, either anti-Israeli pro-Palestinian or pro-Israeli anti-Palestinian. That doesn't really help to de-escalate the situation. There is no active mobilization for dialogue, peace, moderation, compromise.
U.S. President Joe Biden has spoken to Israeli Prime Minister Benjamin Netanyahu and the president of the Palestinian Authority, Mahmoud Abbas. He's expressed his support for both sides and for finding a peaceful resolution to the conflict. But the militant group Hamas controls Gaza, and it has fired roughly 2,000 rockets into Israel, killing residents. Michael Hemme is a Canadian living in Tel Aviv.
A rocket just hit my uncle's city today. So I called him up immediately and asked to check to see if he was okay. And I think about it. I think about the Palestinians that are going through the same thing. And, you know, the mothers and fathers and families are calling up their relatives to make sure that they're okay.
There are and will be no winner, says Canada's former ambassador to Israel, unless old land claims are set aside and new leaders chosen.
Hamas is not interested in a two-state solution, so they're happy to have a Bibi Netanyahu and a very right-wing government in power in Israel, because then they can point to the occupier and say that there's no partner for peace.
One high-rise building hit housed residents and international media, including the Associated Press.
That building provided the best vantage point for the world to see the events in Gaza. And now that building is destroyed. And we will work hard to continue to tell the world the important events of Gaza.
Israeli military officials gave the building's owner an hour's notice so it could be evacuated, saying it had information that Hamas had been using the site. AP is asking to see the evidence. Crystal Gamansing, Global News, London.
Turning back to the race to vaccinate Canadians. Across the country, provinces and territories are ramping up the shots. In Ontario, the province's premier is vowing to have every willing adult fully immunized by the end of summer. But as Katherine Ward explains, medical experts say mass vaccination isn't the only thing needed to get the economy going again.
Whether it was the Toronto Zoo, the Aga Khan Museum, or an all-night vaccine party in Mississauga, Ontario, COVID-19 doses were on tap right across the GTA Saturday.
Oh, I'm excited.
The push to get shots in arms ramping up as a steady supply becomes part of Canada's reality.
I think it's possible that we can do, maybe 1.5 or even 2% of the population a day. That would be roughly 150 to 200,000 people.
Experts say the catchphrase from the federal government of a 1-dose summer and a 2-dose fall, where 75% of Canadians are fully vaccinated, is possible.
There's absolutely no reason why we can't have everyone who's eligible in Canada have their first shot by the beginning of the summer.
Still, Ontario's premier is pushing for more.
I just don't believe a 1-dose summer. It's just not good enough. If we get the supply, I'll put it this way, we get the supply, we will work our backs off to have a 2-dose summer instead of a 1-dose summer.
But other infectious diseases physicians say the premise of achieving a certain level of vaccination shouldn't be the only metric considered when it comes to reopening portions of the economy and some activities.
It's actually looking at a number of things together, but with hospitalizations as the central piece.
The thought being that if the overall trajectory of COVID-19 transmission is decreasing, with pressure slowly easing on the hospital system, combined with increased vaccination rates, a cautious opening could happen soon.
Even if there is a rise in cases when you open up, because the majority of people, or at least a significant proportion of people, are immune to the virus, you're not going to see it spreading like a rapid fire. And even if you do have a lot of cases, because a minority of people are going to be hospitalized, it's also something you can deal with.
Katherine Ward, Global News, Toronto.
Some provinces have put a pause on the AstraZeneca vaccine, but more doses arrived this week. They're now being held in storage until they're requested. So what does the Canadian government plan to do with the remaining shots? Our Mike Couture is hosting the West Block and asked Procurement Minister Anita Anand that very question. Mike.
Well, Robin, the federal government received 655,000 doses of AstraZeneca last week, but it's not clear when the provinces will use them. More than 11% of those already vaccinated in Canada received the AstraZeneca dose, but a number of provinces paused the use of the vaccine after reports of more than 28 very rare blood clots. So what happens if there are still unused doses even after those who got their first dose of AstraZeneca get their second dose of that shot? What does Canada plan to do with those leftover doses? Well, we put that question to Federal Procurement Minister Anita Anand. If your point is that if there's excess, does that mean we're looking at the rest of AstraZeneca as a possible donation to other countries?
As I mentioned, the conversation about doses and any excess doses is one that is occurring at the current time. And so we need to engage with multiple ministries on this question and make sure that we are fulfilling the needs of Canadians in terms of getting vaccines to provinces and territories, as well as our obligations to the developing world. So we'll have more to say on the question of donations in the future.
We also asked the minister if she is confident that there wouldn't be any vaccine delivery delays that could prevent Canada from meeting its goal of getting 75% of Canadians their first dose of vaccine and 20% getting their second shot by the summer, so that restrictions can be eased.
That 75% number was determined based on our expected procurements. So I am confident that we will continue to bring in millions and millions of doses for Canadians. We expect over 40 million doses prior to the end of June and over 100 million doses by the end of September.
And the minister said she hopes those timelines can be moved up, but she believes the current timelines are realistic. Robin.
Mike Licatur in Ottawa. Thanks, Mike. And you can see the full interview with Minister Anand tomorrow on the West Block, right here on Global. To mask or not to mask? That's the question Americans are asking tonight. The Centers for Disease Control and Prevention issued new guidelines indicating it's safe for people who have been fully vaccinated to take masks off while indoors. As Jennifer Johnson reports, businesses will just have to trust the people they're dealing with that they've really been vaccinated.
The burden is now on every state and every business to enforce the rules, now that the Centers for Disease Control says vaccinated people no longer need to wear masks. But with no show of proof, how do you really know if someone who says they've gotten vaccinated actually got the shot?
To be less than 6 feet distance because I'm vaccinated, I'm just concerned that the next person, how honest are they going to be?
Decisions on where people can go maskless fluctuate from state to state, setting to setting. North Carolina, for example, has lifted its mask rules in places like stores and restaurants, but
there will continue to be a mandatory indoor mask requirement on public transportation, in childcare, in schools, in prisons, and in certain public health settings.
The CDC guidelines were intended to relax the rules for those who have gotten immunized.
People who are unvaccinated should not be taking off their masks.
But now it's an honor system. You have to trust who's nearby.
I think everyone's going to lie just so they don't have to put it on.
Big name companies like Starbucks, Target, and Home Depot say they're keeping their mask mandates, but others, including Walmart and Trader Joe's, won't require masks for vaccinated people, nor any proof. Something many local leaders agree with.
We don't want this to turn into sort of like a show me your papers moment. We'll just have to trust what people tell us.
The CDC's decision came after cases of COVID-19 went down by over 30% last week, while vaccinations are still increasing. 120 million Americans are fully vaccinated so far. While that's just a third of the country, many people are excited to take another step back to normal.
I'm fired up to go maskless. I think it's going to be good for the community.
But the patchwork of rules is confusing, so Americans will still have to be prepared to mask up, depending on where they are. Jennifer Johnson, Global News, Washington.
Coming up, nurses wanted and speeding up the programs to meet the demand. Nurses have played a pivotal role during the pandemic. Many are working long hours because of chronic staff shortages. This week, Ontario announced it's funding 2,000 new spots in post-secondary nursing programs to help fill the gap. But as Ross Lord explains, more incentives may be needed to entice Canadians to become nurses.
In her childhood, 21-year-old Sydney Flores was inspired by how nurses cared for loved ones who passed away. Now she's been accepted by the nursing program at the University of British Columbia.
I really witnessed the compassion and kindness of nurses, and I thought to myself, that's what I want to devote the rest of my life to doing as well.
There's never been more admiration for nurses, with the pandemic forcing them to work in unbearable conditions. They're among more than 66,000 healthcare workers becoming infected with COVID-19 and dozens dying. But universities are reporting an increase in students applying to enter nursing schools Applications at UBC have gone up from 500 a year to 800. And many nursing students say the pandemic only strengthens their resolve.
You hear the nurses talking about just how awful it is. Sometimes definitely the nerves come in and I get a little bit scared to jump into it. But for the most part, I'm pretty eager to get out there and start helping out.
COVID has highlighted the different longstanding inequities in our healthcare system. And moving forward, I think that's something I would like to work in combating those systemic inequalities.
Facing a predicted national shortage of 60,000 nurses by next year, universities are switching to accelerated programs.
With our new curriculum, those coming in directly from high school can finish the program in 3 years. It's 3 calendar years compared to 4. In the past, it would have been 4 what we would call academic years.
There's plenty of goodwill. During National Nurses Week, the Prime Minister and many others posted thank you messages. But Canada's largest nurses organization says attracting enough new nurses to offset pandemic burnout and attrition requires much more than kind words.
Why don't we just give free education for healthcare workers, healthcare professionals throughout the country for 4-6 years until we get over this bump?
She's glad help is on the way, but doubts it will be enough to prevent a healthcare crisis from becoming even worse. Ross Lord, Global News.
Still ahead, it won't happen by accident. So is Canada ready for the electric vehicle revolution? As the world shifts to greener and cleaner cars, the big question is whether Canada is ready to join the electric vehicle revolution. Tonight on The New Reality, our Mike Drolet plugs into the issue. Mike?
Robin, it's dangerous to say we can all agree because there's never 100% consensus on anything. But it's fair to say that the future of transportation is in the electric car. That said, tonight on The New Reality, we take a closer look at the hurdles we're facing to get there. And we were surprised to see, for all the political blustering and talk of a green future, Canadians aren't exactly clamoring for the opportunity to plug in their car. It's no secret this has to end. Emissions from cars and trucks are choking the planet. You don't have to be a scientist to see a problem with tailpipes coughing up black clouds of smoke. Yet here in Canada, our love of SUVs and pickups has helped raise overall emissions from transportation about 30% over the last 20 years.
Now, Canadians drive some of the largest, most polluting vehicles in the world. Transitioning to electric vehicles is going to be key if we want to get on track with our emission targets, in the near term and by 2050.
So what's the problem? When will Canadians turn their backs on the internal combustion engine?
So I think they're getting ready. They could push harder, but I think there is also the chicken egg problem, right? If you don't have the EVs on the road, does it make really sense to invest that much in infrastructures? But if you don't have the infrastructures, does it make sense to buy an EV?
It's a quandary Alexandre Milovanov and his University of Toronto peers have been studying. The biggest issue is cost. Even though the number of EV models on the market continues to grow, they still cost more than their gas counterparts. And while lower cost options are available, to do so is also to give up range, which is the other biggest hang-up for consumers. Range anxiety is very real. The top-end models can go up to 600 kilometers on a single charge, far more than most people would need on any given day. Even the lower-end models that top out around 200 kilometers is more than the average person uses on their daily commute. Yet the issue still remains. Robin?
Mike Drolet in Toronto. Thanks, Mike. And there's a lot more in Mike's report, including, is Canada's power grid ready for an EV revolution? That's on The New Reality tonight at 7, right here on Global. Up next, he had 147 tickets to ride, and he took a tour of Toronto at the same time. We'll explain. Toronto's transit system, the TTC, is one of the largest in North America. And if you add up all the routes, it's just under the length of a drive across Canada. Riding every single line would take 147 trips. And one Toronto teen just completed that feat. As Kayla McLean reports, he took that journey with his dad by his side.
Most ride the TTC as a way to get from point A to point B, but not Ian Welsman.
He rides the Red Rocket.
I would call it an adventure.
For the challenge.
I wanted to ride every single regular bus route in Toronto before my 13th birthday.
And so he did. Not only riding bus routes, but every TTC route, including the subway and streetcar. 147 routes in total. And Ian reached his goal a week before his 13th birthday.
I took the Sunnybrook bus to the hospital and back. When I got off, I just raised my hands in the air. It was a very happy day.
To understand his excitement, you've got to understand his journey.
So here we are.
Ian and his father, Derek, began their TTC Adventure Challenge when Ian was only 5.
I've always had a fascination with transportation. When I was younger, I watched a lot of Thomas the Tank Engine, and then every morning we'd go to daycare.
Right now we're at St. George Station.
I learned to say the stop names as they went by, and so it's kind of just come from there.
So great is Ian's love for the TTC that he even penned a song about his favorite station.
On SoundCloud, have a listen.
And with Ian, he doesn't need a map to get around. After these adventures, he's got all the TTC routes mapped out in his head.
We took the 125 Drury to Bathurst, 160 Bathurst North Seals.
He's a passionate guy.
For Ian's dad, tagging along for the ride has meant not only discovering new places, but creating priceless memories with his son.
Totally bonding experience. We refer back to adventures that we've had. As soon as we get out onto a streetcar, all the stories start to come out again.
As for whether a career with the TTC is on the horizon, Ian says he's still deciding.
Sometimes I consider being a TTC driver.
But first, he'll need to consider getting a summer job.
The free rides are over, my boy.
If he wants to keep up his transit adventures. Kayla McLean, Global News.
Free ride is over. That is Global National for this Saturday night. I'm Robin Gill. Tonight, your Canada is Regina. We'd love to see your corner of this country, so please keep sending your photos to viewers@globalnational.com. Thank you for watching. Have a great night.